Well, I think global health, which has emerged as an idea without a great definition, which I think is wonderful. It's like the early days of molecular biology. No one quite knew what it was. But I think it provides an opportunity to merge, in essence, what Mary Robinson was talking about with what Tony was talking about. Science and moral imperative. And it's an opportunity for our science, which has always prided itself on being very international, to actually learn how to be global as opposed to international. And that is to engage the global community in global problems. Not simply that we all share the same journals and we all travel around the world and we go to international things, et cetera, which is wonderful, but to actually be able to address as a global community global problems. And I think there's two levels of that. One is the science itself, and the other, I think equally or more important, is the ethos of science, is to bring the ethos of science, of innovation, of discovery, of change to healthcare. And so global health as a science is both relates to the types of things Tony was talking about. What are the unsolved medical and public health problems, particularly that have been ignored because of the disparity of resources and in all ways. The developing world has not had the resources, has not had the institutions, and the diseases that overwhelm, and conditions, health conditions that overwhelmingly affect the developing world, in many ways have been ignored. There are, as far as I'm concerned, there are basically three aspects to what's going on, and that is engaging the scientific community in bringing science to solving problems that have been ignored, of maternal mortality, of neonatal mortality, of HIV and malaria, et cetera, of aspects of nutrition that we haven't understood. And maybe we'll talk a little bit about how that's gone, and it'd be fun to talk perhaps about the global grand challenges, because it was a very interesting, and it is a very interesting measure of that global commitment to solving global problems. Another incredibly important, and I think opportunity in science for global health is something where I think global health science can feed back and teach us an enormous amount about innovation for our medical technology, and that is the demand to create what we called at the Gates Foundation's deliverable technologies, to actually understand the challenge of cheap drugs, cheap medicines, once a day, once a year, needleless vaccines, on, that are actually fundamentally solving the problems of how technology is best delivered to all people in a way that they have access to. That's an enormous intellectual and technical challenge. And there's great examples for it. And then the third thing, as I said, is to bring evidence-based experiments, competition of ideas, open ideas, to critical aspects of health delivery. And that's included things that Mary has mentioned, such as very novel approaches to global financing, and I think some very novel experiments that are going all over the world on creating functioning health systems in very, very different environments, and perhaps we can talk about some specifics. So that's what I think it entails.
That's great, just great. Thanks very much. Mike, your turn.
Sure. Well, you asked us to take a 50,000-foot view, so I'm going to really do that and say, and sort of reflect on what we heard earlier and say, what are the fundamental problems in global health? And we can use HIV as a paradigm, as an emerging disease. I would say the number one problem is one we don't talk about at all. It's population growth. The reason we have emerging diseases is because we have more and more people living in places where they didn't live and interacting with animals. And you can look at a whole range of public health problems. You can look at disasters and the increased mortality from disasters. We have more people living in marginal areas than ever before. So I think if we're going to solve the issue of global health and those problems, we have to deal with that. And the second fundamental issue is poor government. we have governments around the world that do not see the health of their populations as their business. And I have met, and I'm sure we all have, with ministers of health in many countries who don't have any indicators of, or any willingness to look at the health of their populations and what they should do to treat them. So I guess I'm a little bit contrarian here, because I think technology is a great thing, and we heard about what it's done for us in HIV, and there's 1,000 paradigms where it's been successful. But I think we could have a major impact on the health of the developing world with the technology we have now. We could solve almost all those problems if we address the issues of population control and having good government. And all the things that President Robinson was talking about, about empowerment of women and about education, all those derive from good government. So I think as a public health professional, that's where the big gains are going to be made in the next 50 years if we have to do it. And I think, we just don't think about it. It's the gorilla in the room. I'll give you an example. We talked about PEPFAR, right? So PEPFAR, I worry about PEPFAR because people have such an emotional reaction against the ABC part that there are people who were arguing we shouldn't refund it, people who are advocates for public health. So clearly there's an emotional component. But if PEPFAR were to end tomorrow, everybody would turn off the lights and go home and there'd be nothing left, right? So whenever we do an intervention, it has to be an intervention, whether we're an NGO or a school of public health or a government, that leaves infrastructure. And so when PEPFAR gets refunded, I hope that there's a small amount. If they took 1% and said, let's train health professionals so that when we leave, everybody who's working in that system when we leave with PEPFAR came from that country and understands the country. Let's put money into education, and then let's evaluate what we're doing. In PEPFAR, we don't know what we're doing to the epidemiology of that virus, to the resistance of the virus, and it's such a huge amount of money. And I think if we understood those things, that you need to build infrastructure, you need to train people in country to do it, and you need to change government and how they view their responsibility, we wouldn't need new technology.
Right. It is sometimes argued that, the fundamental problem that we're dealing with in the global health area is lack of development. Mm-hmm. That development is going to solve these problems. Right. And we can ameliorate some of the problems at the margin with this fantastic effort that's being made in medical technology, medical investment, and health and so forth. But at the end of the day, it doesn't amount to that much if these countries stay poor. Right. And the reason for that, it is argued, is that the supporting infrastructure for ongoing enlightened health policy just isn't there. Mm-hmm. Now that sounds to me a little bit like a counsel of despair. I'm just curious to know what both of you guys, how you react to that argument when you hear it.
I mean, I want to make sure that I think some of these issues that are saying are true, but I'm not sure we should set them up as either or.
Right.
First of all, in terms of development, there was a long discussion that basically the issue of health would be taken care of by development. If you become wealthy, you'll become healthy, and there's truth to that. But there is truly a moral imperative to deal with individuals who happen to get sick and who are sick, and not simply wealthy or your country's wealthy. That's one thing. Secondly, there's now a lot of pretty good correlative evidence and data and models that have turned that paradigm into a nice virtuous cycle, and that is, it's very difficult to develop when you're sick. And in fact, perhaps the most dramatic example of that in terms of global health happened in the southeastern United States in the early part of the 20th century with the eradication of hookworm, where you saw that intervention was a predecessor to kids being able to go to school, kids being able to learn in school, to the workforce.